what's going on? It's Kelly from Kiss 95.1. I'm here at Renaissance Plastic Surgery to see my doctor, Dr. David Klein. And then we're going to show you the office so you know exactly what to expect when you come to see Dr. Klein and his amazing girls and the staff. So come on in. Hey, Dr. Klein, great to see you again.
Hey, Kelly, how have you been?
Great, how are you?
Good to see you. Come on in.
All right, so why am I at Renaissance Plastic Surgery? Because Dr. Klein did my surgery and I love this place. I had amazing results and amazing experience. Not a lot of people, they don't know exactly what to expect when they come here. So what we're gonna do is we're gonna walk you through so you can see exactly what a consultation would be like. We're gonna show you all kinds of great little nooks and crannies in the office that you've often wondered about, and he is here to give us a tour and answer all our questions.
Well, that sounds great. Well, we start with the waiting area. The first thing is when I come to doctor's offices, you don't want to walk past everybody. You come right in, you want to be greeted. Pamela's usually here. I purposely did not put glass up. I really don't like walking up and having to stand and wait. Pamela's always right here. She's going to say hi to you as soon as you walk up. At that point, plenty of space so you're not sitting on top of each other. Try to be comfortable, try to be relaxed. Set you at ease right at the beginning.
Something I really liked was books of before and after shots of results that he's had with his surgeries. I like that, and then again, it doesn't look like a doctor's office. It's very relaxing. It's almost like a spa here in the waiting room.
We try to make it nice. Okay, well, now that we've started here, why don't we go back and start where the consultation starts?
All right.
Okay, let's walk on back. All right, so the first thing we'll do usually is have you come on in and look at a video. Generally, the ladies will help you with whatever you're interested in, whether it be breast surgery, body contouring, what have you. It's a little less intimidating if we give you some information first. So I like to start with the videotapes. Those videotapes are from the Plastic Surgery Society, so they're very standard, very normal that most offices will have. Just to let you kind of relax a little bit, learn a little bit about the procedure. There may be things on there you haven't thought about asking. There may be risks that you're concerned about that it will answer. I think a lot of people in this day and age really are visual, so I think they use video and really like that. We're going to give you all the verbal back there when I'm speaking with you, and then at the end of it all, we're going to send you home with a paper that details the procedure, talks about the risks, talks about the recovery, talks about what to expect.
Right.
So I think we try to get it for everybody. Some people visual, some people hear better, and some people really like the face-to-face. So this is where we start you off with the videotape. Okay, so after we've completed the video, generally we'll head down this hallway and we'll come to the exam rooms. After you've gotten the beginning of what's going on, now we need to be specific to each patient, and this is where we get more personal and really find out, you know, what's working with them. My gals are pretty terrific, and why don't you tell me what you think of my staff?
I mean, from the point that you walk in the door, you know, when you've come here a couple times to see Dr. Klein after consultation, they know you by name, they know your voice sometimes even when you call. That's what I love. Very personalized attention. All of the girls here, they make you feel very comfortable because coming in here can be a little scary.
Absolutely, and we take that very seriously. Obviously, when people are coming in to see me, they're coming in to correct something that they don't like or change something they don't like. That can be a little intimidating, man to woman and so forth. So, so I like my gals to come in, chat with you a little bit.
Absolutely.
Kind of, maybe you might ask them a few things that you're a little nervous to talk about. And they'll generally set you at ease and kind of prepare you for me to come in. And you know, then it really becomes me knowing you and you knowing me and getting comfortable with the whole situation.
Absolutely.
Yeah. One of the things we do in here as well is, as I mentioned, some people see better in video, some people listen better. So in here, we're going to talk. We're going to be face-to-face. We're really going to spend a lot of time. I don't rush. I'm going to talk to you as long as I need to talk to you. If you've got questions, I'm going to answer them. And when you leave, I'm going to send you home. Each procedure that we do has specific sheets. Goes through start to finish, risks, recovery, etc. What's expected of me, what's expected of the patient afterwards, so that somebody has something to hold on to. I find that very helpful when people get home after their surgery, their family, you might be still sleepy, your family member is a little nervous because they've never taken care of you before after this. And so I find that having, you know, written sheets of call me for this, call me for that, this is what you do for this, this is what you do, I think that's very helpful. And it just kind of takes the guesswork out. And always 24 hours a day, you can call me anytime.
Right, plus after, you know, you leave your consultation, sometimes you get home and you're kind of a little overwhelmed, you can just look at the sheet and it tells you everything you need to know.
Right, right. And we will go over that stepwise with you at first. Okay, why don't we take a look in the OR and actually see where the magic happens.
Okay.
Here we go. Okay, back towards the operating room. What we do first, of course, we have to prepare the patient. We're not operating in street clothes, so we're going to come into the preoperative room.
Ooh.
And this is where we get everybody ready for surgery.
I call this the warm robe room because you get a nice warm robe. It makes you feel comfortable before you get all hooked up and all that stuff before surgery.
Right. And this is where I'll see the patient right before the surgery, on the day of surgery. I might not have seen them for a week or so after their last visit. So I want to come in and I want to talk with them. Their family member comes back with them. We get them warmed up because surgery is kind of a chilly place, but we want them warm here. We've got a heating blanket. We warm the robes up for them. And again, this is one more time where I interact with my patients to make sure that they are comfortable. Any last second questions they might have, anything that's bothering them about the whole deal, and just make sure that they're ready and I'm ready, and that we're on the same page, because that's critical to make sure we're both going in with the same ideas and same expectations.
And this is where you do your marking too. You draw on people.
Absolutely. Got to be like the TV doctors and draw on your patient. Some people really like the drawing part. It's kind of weird, but it's okay. Okay, let's walk back towards the operating room now.
Where the magic happens.
Absolutely. So back here we have the operating room, and basically I'm just going to crack the door for you because we want to always preserve the sterility and safety of everybody. So you can see we have plenty of space. We're not really cramped. We have all the safety equipment we need. Speaking of safety, we are like any office operating procedure room. You have to be certified by one of the agencies. We are certified, as the hospital is, as surgery centers are, because this is a surgery center. It just happens to be a private surgery center. But we have safety equipment. I pretty much have triplicate of everything. A little bit of overkill for safety is not a problem in my book.
Absolutely not.
And I think you always feel better, the patient always feels better, and knowing that we have that, and we go through those rigorous checks and balances. We have people come in and inspect us every year, and we really have to meet those stringent guidelines. It's essentially a mini little hospital here, and we take that very seriously.
Absolutely. I love Renaissance Plastic Surgery. I can't say enough good things about the work that you've done for me.
Yeah, that's good. Last step, which Kelly doesn't remember very well.
Normally people who come out of surgery probably are like, I never saw this room here.
Absolutely. But everybody comes to this room, and we have this is the recovery area. As you see, not very far from the operating room. In the recovery area, I will have my nurse sit with you the entire time. Like I said, safety is important, so we have monitors to keep the patients hooked up, making sure their blood pressure and heart rate and everything is good. I like to watch everybody for a good hour or so. It takes them about that long. We use short-acting anesthetics, but we want them to wake up. We want them to be coherent before we let them go home so that everything is safe. My nurse is going to stay in here. If it ends up that two people are pretty sleepy, we want to preserve privacy once again, so we'll pull the curtains. We'll let their family come back and sit with them if they're having a little trouble waking up, so that when they do wake up, they see not only Meredith, my nurse's friendly face, but their spouse or their family member who's hanging out with them. So we really want to keep it very professional, but as friendly and as nice to the patient as we can. Okay, and so finally, after they're safe, after they've recovered and they're coherent enough, what we want to do, we actually give them a little ride in the wheelchair. We want to treat them like the queens that they are and take them on out. And we go out the back door, and you know, everything about cosmetic and elective surgery really should be very private. And so I've taken great pains to make sure that everybody, number one, is very comfortable, two, it's very professional, and most importantly, safe. But number three, I always respect their privacy. Some people are happy to tell about their surgery and others are not. Kelly, being on the radio, has told, and that's good for some people, but other people kind of want to keep it sneaky. So when you come out the back door here, we've got a nice tall hedge that we planted. Nobody will see you coming out, and we'll take you right out to your waiting car or chariot to take you on your way back home for recovery.
Plus, you don't look good after surgery. You don't want people to see you.
Right.
I have no makeup on.
We want to keep it quiet.
Yes, exactly.
All right, Kelly, well, thanks for coming by. I'm glad we got to show everybody the office. Hopefully, you know, you learned a little bit. Some of the things you might have seen for the first time, actually, in memory.
I know. I didn't remember a lot of the parts of the office.
Right. But
it's a clean tour.
That's kind of how it's supposed to be. We want the whole surgery to be pleasant. But anyway, it's been a good time. I'm glad you came by. Hopefully you enjoyed seeing. Hopefully this has answered some questions about Renaissance plastic surgery. Give us a call anytime. We'd love to see you.
And I've had my surgery done here with Dr. David Klein. And again, the ladies that work for him and Dr. Klein, he's answered every question. Any phone call that I ever made has always been returned, and that's very important. He makes you feel at ease, he does amazing work, and I mean, he's just awesome. Thank you so much for having me, Dr. Klein.
All right, Kelly.
I've been here a million times. I love this place.
Good to see you again.
Make sure you go to your-renaissance.com right now. Check out before and afters. You can also get all kinds of information, and of course, book your free consultation so you can change your life forever like I did with Dr. Klein and Renaissance Plastic Surgery.